Good evening, everyone. This is Dr. Mehta from R&T Medical College, Udaipur. Today, we are going to discuss about a zoonotic virus called Nipah virus, which is an emerging threat to the humankind. So, these are the news articles. On 4th September 2021, Kerala State Health Department reported an isolated case of Nipah virus disease in Kozhikode district, Kerala State, India. Nipah has a relatively high case fatality ratio and is an emerging zoonotic disease of public health importance in the Southeast Asia and Western Pacific WHO regions. So, India, it is the fifth outbreak in 2021. First outbreak was seen in Siliguri in West Bengal state and Nadia district in 2007. Both the outbreaks were seen in West Bengal. In 2018, an outbreak was reported in Kozhikode district, and in 2019, another outbreak in Kochi district, both in Kerala state. So the Kozhikode has experienced two previous Nipah virus outbreaks in 2018 and another in 2021. During the first outbreak in 2018, a total of 23 cases were identified with 17 people succumbing to this zoonotic virus. Why are we discussing today is the Kerala Health Department late on Monday on 11 September issued a high alert in Kozhikode district after two people died by suspected Nipah virus infection in the span of 2 weeks on August 30 and September 11. So what is Nipah virus? We will discuss about all these things like introduction, its transmission and reservoir host, then clinical picture, diagnosis, treatment, prevention and control measures. So it's an emerging zoonotic pathogen. Nipah virus is a zoonotic virus transmitted from animals to humans and in some cases from person to person. It belongs to the family Paramyxoviridae and genus Nipah virus. Nipah virus first identified during an outbreak in Malaysia in 1998 and subsequently in Singapore. So next is transmission and reservoir host. Fruit bats of Pteropodidae family, particularly species from the genus Pteropus, are considered the natural reservoir hosts of Nipah virus. So transmission to human typically occurs through the consumption of contaminated date palm sap or close contact with infected animals or person-to-person contact during outbreaks. So we can see in this image, Nipah virus transmitted from animals to animals. Mainly it's a zoonotic virus through blood, urine, saliva, or fruit bat droppings, then consumption of a contaminated date palm sap. So it is transmitted from animals to human through this contaminated material, or it can get contaminated from human to human, transmitted from human to human. So incubation period for Nipah virus ranges from 4 to 14 days after the exposure to virus. Then we will discuss about the clinical picture. Initial symptoms include non-specific flu-like symptoms like fever, headache, muscle pain, fatigue, weakness, dizziness. Some respiratory symptoms. Some patients may develop respiratory symptoms such as cough, sore throat, shortness of breath. And in severe cases, Nipah virus infection can progress to encephalitis, which is the most critical and life-threatening aspect of the disease. So encephalitis is characterized by symptoms such as altered mental state. So patient will be having confusion, disorientation, seizures, stiff neck, focal neurological signs like weakness, paralysis, and patient may eventually go into coma followed by death. Atypical symptoms include Nipah virus infection may also present with atypical symptoms including nausea, vomiting, abdominal pain, and diarrhea. So long-term effects. Survivors of severe Nipah virus infection may experience long-term neurological sequelae including cognitive deficits, memory problems, recurrent seizures, motor deficits. How will we diagnose Nipah virus? So diagnosing Nipah virus infection requires a combination of clinical evaluation, laboratory testing, and epidemiological information, especially during outbreaks. Here are the key methods and steps involved in diagnosis of Nipah virus. Firstly, clinical evaluation. So the physician will assess the patient medical history, clinical symptoms, paying attention to any exposure to risk factors such as contact with sick animal or individuals. Then we have to collect the specimens. So various clinical specimens are collected from the patient, including blood, throat swabs, nasal swabs, cerebrospinal fluid in case of suspected encephalitis. These samples are collected under strict infection control measures to prevent further transmission. So the person collecting these samples will be wearing appropriate PPE. Then laboratory testing. All these samples are sent to National Institute of Virology, Pune. So reverse transcription polymerase chain reaction, RT-PCR, is a molecular technique. It detects the viral RNA in patient samples, providing a rapid diagnosis. Serology. Blood samples are tested for the presence of Nipah virus specific antibodies, which may appear in the late stages of infection. Then virus isolation. Attempts are made to isolate the live virus from clinical specimen, such as throat swabs or CSF, which requires specialized biosafety facilities. Then immunohistochemistry. In fatal cases, postmortem tissue samples can be analyzed using immunohistochemistry to detect viral antigens. Next is epidemiological information. So we have to take history. So information about the patient's travel history, exposure to animals, or contact with other potentially infected individuals is crucial in confirming the diagnosis. Then confirmation and reporting. Positive test results for Nipah virus should be confirmed by a reference laboratory or a specialized facility, which is NIV in India, which is situated in Pune. Then all confirmed cases must be reported to the appropriate health authorities to initiate outbreak control measures. And differential diagnosis. Nipah virus infection can mimic other diseases such as influenza, dengue, or other encephalitic illnesses. So differential diagnosis helps rule out other potential causes of patient symptoms. Then isolation and infection control. So patients with suspected or confirmed Nipah virus infection, they should be isolated to prevent further transmission. Healthcare workers and caregivers should follow strict infection control measures, including wearing personal protective equipment. Then we have to offer supportive care. So no definitive treatment is available till date for Nipah virus. Matlab no specific antiviral treatment is available. So we have to offer first supportive care. It is crucial for patients with Nipah virus infection, especially those with severe cases or encephalitis. It includes providing hydration, nutrition, and maintaining electrolyte balance. Mechanical ventilation may be required for patients with severe respiratory distress. Then antipyretics and pain management. Fever and pain can be managed with antipyretic medications like acetaminophen or pain relievers like non-steroidal anti-inflammatory drugs and opioids in case of severe pain. Then seizure management. Patients with Nipah virus encephalitis may experience seizures and should be treated promptly with appropriate anticonvulsant medications. Then experimental therapies. During outbreaks, experimental therapies or investigational drugs may be considered on a case-by-case basis. So, however, their efficacy is not well established. Then administering intravenous immunoglobulin. It may have a beneficial effect in treating Nipah virus infection, but further research is needed to confirm its effectiveness. Then research and clinical trials. Ongoing research aims to develop specific antiviral drugs and vaccines for Nipah virus. Patients may be enrolled in clinical trials to evaluate potential treatments. Prevention is the main part of PSM. So preventing and controlling Nipah virus outbreak involves a combination of strategies to reduce the risk of human exposure to the virus and manage cases when they occur. So these measures are particularly important during outbreaks. Here are the key prevention and control measures for Nipah virus. First of all is education and public awareness. Public health campaigns should educate communities about the risk of Nipah virus, its mode of transmission, and preventive measures. So promote awareness about not consuming raw date, palm sap in endemic areas. So beware of Nipah virus. So the healthcare workers should be wearing personal protection equipment. Then avoid the fruits which are damaged and bitten by bats, birds, and animals. Keep away from these animals. So protecting the wells from bat and drink chlorinated and boiled water. Don't drink the toddy-like liquids which are collected and stored in open pots. So they have high risk of contamination. So protection from fruit bats. Fruit bats, particularly Pteropus species, are natural reservoir hosts of Nipah virus. Efforts should be made to reduce human-bat contact. Avoid handling bats or coming into contact with their secretions and excretions. Prevent bats from entering living spaces, especially in regions with known bat populations. Then safe farming and animal handling. Prevent contact with sick or dead animals, particularly pigs, which can act as intermediate hosts and amplify Nipah virus. Implement good farming practices and proper disposal of animal carcasses. Then avoid consumption of raw date palm sap. Nipah virus can be present in the sap of date palm trees contaminated by bats. Communities in endemic regions should avoid drinking raw date palm sap. Promote boiling or cooking sap before consumption to kill the virus. Then infection control measures. Healthcare facilities should have strict infection control protocols to prevent nosocomial transmission. Isolate suspected cases or confirmed cases and provide appropriate personal protective equipment for healthcare workers. Rapid identification and diagnosis. Early diagnosis and reporting of suspected cases are critical in outbreak control. Develop and maintain diagnostic capacity in local and regional laboratories. Then contact tracing and quarantine. Identify and monitor individuals who have been in close contact with confirmed cases. Quarantine suspected cases and individuals with symptoms to prevent further transmission. Similar to COVID management. Then travel restrictions during outbreaks. Travel restrictions may be imposed in affected areas to limit the spread of the virus. International collaboration. Collaborate with international health organizations such as WHO to coordinate response efforts and share information. Surveillance and early warning systems. Establish surveillance system to detect Nipah virus cases and animal outbreaks promptly. Develop early warning systems to alert healthcare and public health authorities to potential outbreaks. So impact and outbreaks. Nipah virus outbreaks have occurred primarily in Southeast Asia with Bangladesh and India experiencing recurrent outbreaks. These outbreaks have significant public health and economic impacts, often leading to quarantine measures and loss of agriculture income. Global significance. It is considered as a priority pathogen by WHO due to its potential for causing large-scale epidemics and its high mortality rate. It can be used as a bioterrorism weapon. So it is classified as CDC category C bioterrorism agent. It has potentially high morbidity and mortality. It has aerosolization potential. Then it causes economic impact, health impact, and social disruption. So this is all about Nipah virus. Thank you.